A Fox 5 News special report.
Good afternoon, everyone, and thank you for joining us. I'm Maria Arcega-Dunn. This is a Fox 5 News special report. Governor Gavin Newsom is providing an update on California's response to the coronavirus pandemic. It just began, so let's listen in.
PPE we've been able to distribute in the last few weeks, which is foundational in terms of our efforts to begin to meaningfully modify our stay-at-home order and begin to reopen our economy. Update you on the daily numbers and trend lines, and preview a few things coming up later this week. But let me first begin by making a statement reinforcing some of the words I've been saying over the course of the last few weeks. You know, it was just a number of months ago that California was announcing a projected $6 billion budget surplus. I'll remind you, this time last year, that surplus was projected to be over $21.4 billion. We were debating the size of the surplus and how best to manage our budget with that surplus in mind. But just 90 or so days ago, a projected $6 billion budget surplus. We reflected on the fact that this state over the last 5 years has enjoyed 3.8% annual GDP growth, substantially outperforming the rest of the nation. In so many ways, in the last 5 or 6 years, we've really become the tentpole of the American economy in terms of job creation, in terms of economic output, not only reflected in those GDP numbers, but the consecutive months of net job growth. We had record low unemployment, record reserves in the state of California, paid off that wall of debt, which become so infamous in the state of California, and saw our bond rating, independent of any assertions by an elected official, our bond rating agencies upgraded the state on 2 occasions in the last year. I say all that, and as I said all of that on multiple occasions, to just reinforce the current status, and that is those numbers are completely flipped. We now are struggling with tens of billions of dollars in budget deficits directly as an impact directly caused because of the impact of this disease, COVID-19. Unemployment has skyrocketed in this state, some $13.1 billion of unemployment claims we have distributed. $13.1 billion in cash has been distributed to people struggling and suffering because of the economic consequences. 4.5 million Californians that have filed for unemployment insurance and PUA, pandemic unemployment assistance, just since March 12th. 4.5 million just since March 12th. $13.1 billion distributed, $3.4 billion just last week. It gives you the magnitude of what's happened in just a short period of time, 90 or so days in this state. Unemployment numbers that, when new numbers come in, will be north of 20%, getting closer to 22, 3, 4, 5%. Very, very likely. And so the challenge is enormous. And this challenge is one that's not only presented to us here in the state of California, but it's a large percent, getting closer to 22, 3, 4, 5%. Very, very likely. And so the challenge is enormous. And this challenge is one that's not only presented to us here in the state of California, but it's a challenge that will be felt all across the United States, and for that matter, around the rest of the world. You're seeing numbers come in states large and small, the impact to the general funds of their budgets. States like California that were running some surpluses now running historic deficits and challenges related to unemployment claims, the likes of which they haven't seen since the Great Depression. These are challenging times, and they require a collaborative spirit. They require a level of cooperation that led to conversation with our Western governors and our Western PAC, where we decided it would be best if we go together and advance our needs and put to light and put into writing our hope and expectation of support the federal government. And today we are putting out jointly governors of Oregon, Washington, Nevada, and Colorado and their respective leadership in their assembly and in their state senate. Some are House of Representatives, depending on the state. But the signature of the Speaker, the leader pro tem of the Senate, not just the Assembly, in each of those states, and the governor, and our Speaker, Anthony Rendon, our pro tem, Tony Atkins, and the minority leader of the Assembly, Republican Marie Waldron, signed similar letter to the federal government, to Nancy Pelosi, to Mitch McConnell, and others, requesting aid in a $1 trillion range. That's the range of support we feel we need as a nation, states, municipals, as well as counties. This is the requirement of this moment. It gives you a sense of the thrust of the needs that we are all feeling as states, as regions, as city, that are required to get through this pandemic and to make sure that we're doing justice to you, to your public health, to your public safety, to our education system. Because remember, these budgetary shortfalls are so much bigger than any state, any city, any county, but they directly impact public safety, our firefighters, our police officers, our first responders. They directly impact public education and our teachers. They directly impact public health and our ability for counties to support their public health systems. It's not just states asking for a bailout, quite the contrary. It's requesting that we support those that we need the most at this time, our public safety officials, our public health officials, and make sure that we do justice to our public education system. So I'm very pleased with this pact. I'm very pleased with the letter, and I couldn't be more proud and honored by the signatures of all of those, not only our three leaders in this state, but substantively those leaders across the United States in this pact that represent legislative leaders, not just the executives themselves. So I wanted to begin with that, and also extend appreciation for the ongoing collaborative, this best practice sharing that continues within these regional pacts. It continues to, I think, impress not only me, but enliven all of us, the ability for our chiefs of staffs and our Office of Emergency Personnel to continue to share best practices in real time. And just based on a lot of those conversations, this is one of the efforts that we are now making public here today. Another effort we've been focusing on is PPE and doing more together and figuring out ways that we can leverage our purchasing capacity a little bit more. I want to just give you an update. On Friday in the state of California, we did something we've not been able to do in the past, and that is we released 11 million procedure masks to critical industries all throughout the state of California. 11 million masks were distributed just on Friday alone. 5 million masks went specifically to our Department of Social Services, to our child care facilities, our in-home support services, and our other DSS-run adult and senior facilities. And I want to just pause on that for a moment. We talk a lot about skilled nursing facilities, of which there are 1,224. But the Department of Social Services is responsible for an additional 7,442 senior and adult facilities throughout the state of California. These tend to be smaller, but still precious and important. And so when we have talked a lot about SNFs and skilled nursing facilities and getting PPE and more testing, it's also incumbent upon all of us to expand that conversation to all of these other facilities. These are where you have 6 or 7 people, sometimes even less, in small group homes that are very vulnerable to this virus as well. So we were able to get those 5 million procedure masks into that system and broaden our capacity to deliver on our promise to provide that protective gear that's so essential and foundational for not only our public health, the safety of those residents and staff, but also to help us move forward and reopen the economy. Accordingly, we were able to get 4.2 million masks to farm workers and into our agricultural community. 4.2 million just on Friday as well. 750,000 to our groceries and our grocers and our food supply chain. 500,000 masks went into the Department of Education on Friday, and tens of thousands of masks went to transit agencies across the state. Again, all of this is foundational in terms of getting where we all want to go, and that's into this second phase and beginning to continue, or rather to begin more robustly modify our stay-at-home order. And so we talk a lot about testing. We'll be talking more about that tomorrow. We talk about tracing. We talked a lot about that last week and the good work, partnerships with UCSF and UCLA, and how we have that first cohort of 500 that are being trained, almost all of them now trained both online and in person in those 20-hour trainings. But PPE is also foundational in this effort as well. And so that's why I just wanted to share with you those updates and that information as well. Just in addition to that, briefly, we'll open up for questions here in a moment. I want folks to know that we had some very constructive conversations over the last 72 or so hours. 19 different counties engaged our public health officials in dialogues around these self-certifications, these variants that we will start seeing throughout the state of California. So very healthy dialogues. I think there are 9 more scheduled that we have lined up just today. So we've been active in that space, actively working with these counties. In some cases, we are very close, and tomorrow we'll be making some announcements if the counties haven't already in that space in terms of their attestations to their plans, their prevention plans, their containment plans, and all of the guidelines that we put out around them. We'll more formally put out the detailed sectoral guidelines tomorrow to help advance those efforts. That's in the dining space, and that's in the office space, some malls, et cetera. So of language, flexibility, but prescriptive in terms of those guidelines being a little bit more formalized. Those come out tomorrow, and we'll see, I'm sure, more conversations take shape and more engagement being advanced once those guidelines come out as well. But good news, progress in that space, and I know others are more eager to move more quickly, and we will work with every county, with every city in a practical and responsible way. But here's the caveat. This is a health-driven conversation. It's not because we don't want to. It's not because we would not like to. It's not because we want to be particularly oppressive in terms of people's desires and needs. It's because public health dictates that we do this in a judicial way. We're not going to deviate from that path. That's the foundational principle that guided us into the stay-at-home order and will guide us out of the stay-at-home order. Data, evidence. But again, we are flexible in this respect. We're not ideologues in terms of the engagement. We recognize no two counties are alike, no two cities within the counties are alike, and we want to be responsive and respectful to those calls. But know that these are dynamic conversations. Each county requires an enormous amount of attention and support, and we're getting incredible response from the vast majority of counties that have done enormous amount of work already, but there are some stubborn data points that are impediments in terms of total number of hospitalizations, total capacity on surge, total capacity to trace and test, and of course death rates that continue to be challenging. I mentioned just last week that we had seen a good week of a decline in death rates, only to see the week of death rates go back up. I'll begin this week with good news in that respect, but the weekend numbers good news in this respect, 25 deaths, devastating. Nonetheless, 25 lives lost, families torn asunder, but 25 deaths to begin this week, far cry from how we began last week with substantially higher number of deaths. But we're still seeing lives lost from this pandemic. We're still seeing the number of positives increase They increased again overnight by roughly, 1,250 roughly. But we are seeing some good signs as well. Hospitalizations, though they went modestly up 0.9%, we saw ICUs yesterday drop 0.4%. So again, hospitalizations, ICUs bouncing back and forth, but steady. Death rate a little bit better today, but we saw those numbers last week increase and continuing to see the positive numbers go up. And that's just a point of caution and concern as people get ahead of themselves a little bit. And I recognize that those symptoms and in terms of the cabin fever we're all feeling and how businesses are so eager to get back to work. But it is absolutely incumbent upon all of us to be thoughtful and judicious as we move into this next phase. And just to end and to reinforce an important point, this is a dynamic process. Last week, we made an announcement as it relates to retail manufacturing and logistics, allowing from a statewide order those restrictions to be lifted. Modifications still in place, but the statewide prohibitions to be lifted in these lower impact industries. We recognize that there are counties that are still holding a little stronger. The Bay Area wants to continue for an additional week, and we respect the right based on local conditions for people to be a little more strict. At the same time, with these variances, we recognize the same. We want to see people loosen up with conditions that can be met and expectations that can be delivered. But it's also important to note that we continue as a state to continue to move into this phase 2. And we will be making announcements. This is a dynamic process. This is a very iterative process. There's a flow here that you should anticipate where the Department of Public Health will be putting out guidelines, we hope on a consistent basis, to continue to modify the statewide order. So it's a way of long-windedly saying this. For counties that feel like they're just locked in and somehow they're not going to be able to move, that's not the case. We as a state will move together. You may not be afforded the opportunity just yet based on public health to move forward with the variances, but that doesn't mean the state is not moving forward together with you and others. And so we'll be making some announcements this week in that respect that are in addition to the variances where we're all moving through phase 2 together. But it's an important point to reinforce that we're not locked in to the status quo. As long as we keep doing a good job, keep protecting people's public health, continue to see these lines stabilized and continue the good work physical distancing that's demonstrable still, despite an increase of activity across most of the state of California. And so just want to again thank everybody for all their outstanding work getting us to this point.